I want to just start by getting right to the crux of what we want to talk about, and that's the gap between men and women's healthcare, especially with regard to aggressive cancers. Why does that still exist in this day and age?
Well, I think it exists, again, because there was an underfunding and a lack of focus on women's health for all too long in the halls of public policy, at the research bench, and in clinical settings. And, when I was head of women's health decades ago, we shone a spotlight on these inequities, and we developed initiatives to really address them. But there are gaps, and that laser-like focus, was not necessarily maintained. And so we have a ways to go. And, I really want to talk to you today about lung cancer in women, because again, while we did talk about this years ago, it is still a major threat for women. There's a crisis, a lung cancer crisis in America. A friend of mine, Shirabola, just developed it. She's 42 years old, healthy, a runner, eats right, does everything right, but she was a non-smoker. In fact, her father was a pulmonologist. And why? Well, the fact is that, we focused on men for lung cancer because we knew they smoked. And so all the research was done on them. And so we targeted our prevention programs to stop men from smoking. And their lung cancer rates came down.
And I think we all know people who've been through this, who have been non-smokers, like your friend who you just mentioned. Right. Why is this cancer developing in young, otherwise healthy people who don't have those risk factors?
Well, that's the big question, because the research hasn't been done there. We focused on smoking, and again, because we didn't target women to smoke, their lung cancer rates went up. In 1987, lung cancer surpassed breast cancer as the number one cancer killer of women. More women die of lung cancer than breast cancer, cervical cancer, and ovarian cancer combined. Wow. So we need to, target awareness to women. But your question is so important. 20% of cancer deaths are in people who never smoked. And why is that? Again, we need to focus research efforts there. And why women? Women now in 2021, women under 65 surpassed men in terms of their lung cancer deaths among non-smokers. Why? So genetics plays a role. Environmental factors, people who have been around people who've smoked, people in environmental pollution, radon exposure. But there are genetic factors. There's a stronger family history if you've had lung cancer in your family, but other genetic mutations that are just being identified. So this is where the research really needs to focus. And then, most diseases are due to inheriting a gene or a gene with environmental mutations, environmental factors that interact with normal genes and cause them to misspell. So only a small percentage of disease, you inherit that gene and it becomes that disease. It's the environmental exposures. And why are women more susceptible? And that's where we need to focus our research.
So how do we need to be better advocates for ourselves? Because I do feel like when we think of cancer, we don't think of lung cancer for women. You think about ovarian or breast, right? And we have systems in place, especially for breast cancer, to kind of, to make sure you're doing what you need to be doing. There's a system in place, an infrastructure and awareness. But I do feel like, how do you know when you should be advocating to say, I'm a little concerned, or how do we check it out? Is there just something we should do as kind of our regular annual checkup?
Well, I think, again, your question is so important. We need the same kind of national public education campaign that we've done for breast cancer to let women know that this is the number one cancer death for them, right? And number two, there are tests, low-dose CT scans that screen for lung cancer, that can pick it up. And they're recommended, the U.S. Preventive Services Task Force that recommends that mammography and colonoscopy and cholesterol checks, these regular preventive screens, recommends this for people who are 50 to 80, who have a 20-year pack history. So they've smoked one pack a day for 20 years. But that misses a lot of people, and a lot of people don't even know. So, for example, 75% of women go along with getting their mammogram every year, but only 6 to 7% of people get their lung cancer screens who are eligible for it. We're not doing a good job in educating. And then we need to think about and reassess, I think, the screening guidelines, because, for example, should people start getting a CT scan, get a baseline like they do for a colonoscopy if they're average risk, and then do it every whatever number of years that might be. Is it 10 years or 5 years, depending on their risk? Well, I think AI will help us with this. It will be able to scan medical records. It will be able to come up with risk factors for families. We now have a whole new set of tools, from genomic testing to AI, to new screening techniques that will help us to develop better guidelines. And hopefully one day we're going to have a blood test, and some are under development, to find lung cancer.
Just 30 seconds. Our policymakers right now want to do this? Are they in a place, in your view, in Washington, where they're focused on this priority?
I think we're seeing an increased awareness now, and I know several bills are underway. So I'm hopeful, but it's going to take all of us raising our voices and really coming together to raise the awareness. And I want to thank you, Bloomberg News, for doing this, for raising awareness about the crisis of lung cancer in women. As Einstein said, from crisis comes great opportunity. We have the opportunity to change this trajectory. Let's do it.